I'm proud to be part of an organization that values science and respects the health of patients and the environment. The International Academy of Oral Medicine and Toxicology, the IAOMT, is an organization made up of dental, medical, and research professionals. The IAOMT relies upon the scientific literature to form its stance that the toxic exposures from mercury amalgam have a negative impact on the health of people and the environment worldwide. Here in the United States, the dental profession is currently the largest user of elemental mercury, one of the most toxic elements known to man. Unfortunately, dentists are responsible for using up to 30 tons of elemental mercury annually as a component of amalgam restorations, otherwise known as silver fillings. These silver fillings are made of approximately 50% elemental mercury that continuously off-gasses hazardous vapor, which exposes the dentist, the staff, the patients, and ultimately the environment. The IAOMT has been the leader in determining safety measures to protect patients and dental office employees from the toxic release of mercury during routine dental procedures. And for those patients who do have amalgam fillings, we utilize every safety precaution available to protect them when these fillings have reached their end of life and it makes sense to remove them. For 30 years, the IAOMT has actively petitioned local, state, and federal governments about the dangers of mercury use in dentistry. The United Nations Environment Program reports that 10% of global mercury usage is for amalgam restorations. This results in up to 340 tons of dental mercury being released into the global environment each year. The EPA estimates that 1 in 6 children born in the United States have mercury levels high enough to produce neurological damage. Additionally, a large portion of our population are those most vulnerable to the toxic effects of mercury. So to protect the health of all people worldwide, it's imperative that we work towards eliminating mercury's use in dentistry as soon as possible. In the 1950s, Chiso Fertilizer Company had begun to dump its toxic wastewater containing methyl mercury, a byproduct of the fertilizer manufacturing process, into Minamata Bay. This deluge of methyl mercury from Chiso contaminated the local fisheries, which the inhabitants of Minamata relied upon for jobs and sustenance. The result of contaminating the local food supply led to many people exhibiting strange symptoms: tremors, difficulty with speech, numbness in the limbs, and seizures, just to name a few. The impact of this methyl mercury exposure to the children and unborn was devastating, leading to many deaths and disabilities. In October of 2013, the governments of the world united in their efforts to reduce the amount of mercury released into the environment by signing on to the Minamata Treaty on Mercury. This groundbreaking treaty will require governments to implement a number of measures to drastically reduce the amount of mercury entering the environment by banning its use in a number of various sectors by the year 2020. While scientific evidence has proven beyond a shadow of a doubt that exposure to mercury as released from amalgam fillings harms human health, the legislation and political policies necessary to safeguard the health rights of patients lags further behind. That's why the IAOMT has been active at the international level, spreading awareness of the harm from dental mercury fillings and outlining currently available solutions. During the years that the Minamata Mercury Treaty was being negotiated, the IAOMT was actively involved by informing delegates about the large amounts of mercury that the dental profession releases into the environment each year and its potential to harm human health. These efforts paid off, as the final treaty included language to phase down the use of mercury amalgam fillings, and shortly after the convention, the United States government was the first to ratify this monumental mercury treaty. With the governments of the world eliminating mercury use from all products, the end of amalgam in dentistry is near. But we're not out of the woods just yet, as there are still literally tons of mercury in the mouths of over 120 million Americans that will eventually need to be taken out safely and disposed of in a way that does not harm our environment. Because the IAOMT continually updates its safety protocols to reflect the most current science on the matter, I can rest assured knowing that the organization not only has my best interests at heart, but also those of my patients and the environment. To learn more about the International Academy of Oral Medicine and Toxicology, please visit our website, IAOMT.org.